Chapter 9 Therapeutic Communication. Therapeutic communication. This is an area that's going to come up a lot in NCLEX, picking that proper response. Especially when it comes to mental health questions, you're going to see a lot of questions asking you to pick the appropriate response. And well, at first it can seem a little tricky. It's just picking out the quirks, getting those standard rules of how those questions are written. And starting off with the basics, therapeutic communication needs to be patient-centered. Means the patient is that full partner of the care. They determine their own values, preferences, and determine which treatments should be prioritized. Should be goal-directed, scientifically based, and avoid saying the wrong thing. Making mistakes helps us to find more useful and effective ways of helping individuals reach their goals. Can't stress enough that therapeutic communication, it's crucial to the formation of that therapeutic relationship. Another thing to keep in mind as we get going into here, the proper response for NCLEX is not necessarily your proper response. By means your personality. It's not necessarily how you would respond, but once we start getting over these rules and figuring out what NCLEX is looking for, it's going to be a lot clearer for you. And once you get these set rules, you'll be flying through these. You're going to see a lot working in mental health. You're going to get in a lot of difficult situations, tough conversations that take some practice to get through. And there is many benefits. The patient's feeling safer, protected, more satisfied with their care. You're going to see increased recovery rates, improved adherence to treatment. And it's always going to be an open-ended question, something that gets the patient to open up. The answer on NCLEX in the test is very, very rarely going to be a question that the patient could answer yes or no to. It's always going to be an open-ended question. I'm sorry that you seem to be having a difficult time, or what makes you think that? Let's start with some theories and theoretical models of communication. Let's start with a transactional model. It begins with a communicator, usually you, sending a message through a channel, whether spoken word or written, and waiting on feedback as the person you're sending that message to encodes and decodes that message, meaning they process the information you've just given to them. And they process that within context. These contextual frames can be everything from social context, relational context, cultural context. And then from there, they must process it and process that through the environmental noise, whether that's the physical, physiological, or psychological. This environmental noise could be any barrier to them receiving and decoding your message. Case study. You're a new nurse in a psychiatric ward for adolescents. Noah is your first patient. He is depressed and has fresh cuts on his wrist, which is why his mother has had him committed. While he's taking his pulse, you see that Noah also has a number of older scars on his arm. When he sees you looking at him, he shakes his head and whispers, "Yeah, well, it's just gonna keep on happening." Noah's whispered statement of, "Yeah, well, it's just gonna keep on happening," does not involve which of the following: A, channel, B, stimulus, C, message, or D, feedback. D is feedback. Feedback is provided by the person receiving Noah's message. After interpreting and responding, this is what the nurse will do in response to Noah's statement. That feedback is the nurse's response versus the channel, stimulus, and message all came from the communicator, all came from the patient who was initiating the message. What is an appropriate response to Noah's whispered statement of, "Yeah, well, it's just going to keep on happening"? A, report this statement to his parents. B, report this statement to your supervisor. C, tell Noah you're willing to listen if he wants to talk about this. Or D, ignore this statement. The patient is in a vulnerable state and it's risky to say the wrong thing. This is actually a great example. You're trying to get the patient to open up in all of these, and the answer is going to be C. Tell Noah you're willing to listen if he wants to talk about this. Obviously, he's a minor. These scars are something you're going to have to share both with his parents and with the provider. But at the same time, NCLEX is usually testing you on, especially in mental health, you're going to have a lot of personal factors interfering with that communication. Depression, anxiety, cognition, language and cultural barriers, environmental factors such as the setting. It's always trying to find a quiet place to talk. Don't have the patient open up in front of other patients out in that common break room. You want to have a place where you can meet safely with a patient. You want to avoid going to the patient's room in the psychiatric hospital. You want a public place, but a quiet place, off to the side, somewhere you could speak quietly with the patient, speak privately with the patient, and get them to open up, and minimize the external noise, help them relax, and try to build that therapeutic relationship. Verbal communication, just like it sounds, these are all words a person speaks. And especially working in the mental health field and psychiatric patients, it's going to be very important that we choose our words carefully. We want to stay right on topic. We want to make sure that they're understanding. We're getting right to the point. And we're avoiding any judgment. We're avoiding any conflicted messages. That nonverbal communication could be just as important. Being very aware of your tone of voice, being aware that you're not emphasizing certain words that could be misconstrued. You're standing relaxed. You're not standing over the patient. You're not glaring down at them. You have a relaxed physical appearance, relaxed or friendly facial expressions, a friendly body posture. And this nonverbal communication really does form a major part of your communication, both with patients and out in the world. We want to avoid these conflicts or these incongruencies between verbal and nonverbal communication. Messages can appear to be one thing when in fact they are another. People are often less aware of their nonverbal messages and behavior. Your nonverbal communication imparts a lot more than you may be aware of. And verbal messages can be called content, while the nonverbal behavior is the process. And avoid these double bind messages. These are mutually contradictory messages, usually given by a person in power. We want to be very clear. We want to be honest. We don't want to leave anything up for debate. We don't want to give them an opportunity to misconstrue anything, because mental health patients especially will read way more into a situation than really was meant. As you prepare for the initial interview with 15-year-old Noah, you learn that he has a history of cutting himself. His parents have separated and are getting a divorce. His father has left and Noah is living with his mother. Noah's been smoking for about a year and a half, and his mother suspects that he has come home smelling of marijuana twice now. All three behaviors were ongoing before the father left. Which behavior from Noah would be considered a double-bind message? A, he winks at you and says, "Do any of these nurses date 15-year-old guys?" B, he puts his head in his hands, shakes it, and snaps, "I don't want to do this, just get me out of here." C, he sneers at you and almost purrs as he said, "Oh yes, I will tell you anything you want to know. Of course I will." And D, he cries and shakes, juggling one leg as he says softly, "Please, let's just not talk about Dad, God please." And the answer here, which of these messages is incongruent? And that's going to be C. And this is, he's telling you one thing while his body language, tone of voice is saying something completely different. And you really want to be aware of both these contradictions, these contradictory messages, these double bind messages in your patients, and also want to be very, very careful that you're not sending one of these as well. Communication skills for nurses. Let's get into it. Therapeutic communication techniques. We want to use silence. We want to give the patient a chance to respond as much as possible. Use active listening, those clarifying techniques where you'll restate the patient's question. And our questions, open-ended. We always want to phrase them in a way that the patient can't just respond in one word. A closed-ended question would be, "What color is the sky?" That is blue. We want to leave an open-ended question. "That must be difficult to hear. You seem to be having a hard time." These statements and questions that require them to respond with sentences, respond in a meaningful way. Encourage that patient to share information about their experiences. That active listening, the nurses focus, respond, and remember what the patient's saying, verbally and non-verbally. We want to talk slowly. We want to talk friendly with these patients. We want to get them to open up. That is our goal here. Non-therapeutic communication techniques. Excessive questioning. We don't want the patient to feel like they're being interrogated. They will close up very quickly. We also want to avoid giving approval or disapproval. This is going to be a big one. We're neither very non-judgmental responses is what they're looking for. We want to avoid giving advice, and the answer is never going to be a question with why. We never ask the question, "Why did you do this? Why do you feel this way?" The answer on NCLEX is never going to, almost never going to be a question that involves the word why. Noah's made it clear he doesn't want to talk about his dad, but the truth is that the interview proceeds, he becomes anxious and tries to evade all questions about why he's here. Which type of communication might be most appropriate right now? A, stop questioning so much and just give him some good advice so he'll trust you. B, express honest disapproval of his resistance to help. C, ask him point blank why he is evading you. Or D, ask that miracle question. You're going to hear the phrase miracle question come up in your text a bit. And this is that goal setting question. Helps the patient see what the future would look like. Really try to, that one question to reframe and really helps that patient. Really changes the pace of the interview. A, stop questioning so much and just give them some good advice so he'll trust you. That's wrong. We're never going to lie to the patient. We're never going to provide false reassurances. Express honest disapproval. We're going to avoid approval or disapproval. Our goal is to be non-judgmental. And C, right there, it's asking why is he evading you? You can, as soon as you sit down on that question of therapeutic response, you can immediately remove out the ones that include the word asking the patient why, or the ones that are a closed-ended question that you could just answer with one word. And then from there, you look for the best fit out of your remaining options. Cultural considerations. In some cultures, expression of positive or negative emotions is a private affair. They are very closed off, and open expression to them is considered to be in bad taste and possibly a weakness. Another thing to be aware of is eye contact. Some cultures are very involved, direct eye contact. Other cultures avoid eye contact, and it's something you really want to be aware of. Touch may be another one. Some cultures will be very touchy-feely. Other cultures, they don't want you within 5 feet of them. Information communication technologies. Definition: that use of electronic information and telecommunication technologies. There is so much more communication tools at your disposal than you may even be aware of. Use that live interactive mechanism as a way to track clinical data and to provide access to people who otherwise might not receive good medical or psychosocial help. EHRs, telehealth. The digital age really has opened up innumerable avenues for reaching and communicating. That telehealth can take a variety of sources: video conferencing, internet sources, phone consultation, image transmission, interactive video sessions. And mental health is a perfect field for telehealth. Being able to have the patient receive treatment in the comfort of their own home. They're going to be much more willing to open up. It's also much more convenient, both for the patient and the provider. Now, we touched on in a previous chapter all of the mobile applications out there available today. Used to monitor, diagnose, treat, and communicate with patients. Mobile phones are used at an extremely high rate. There is so many apps out there that you can find a specific app for almost any major condition you could think of. Not to say that there isn't concerns with all those apps and telehealth and mobile digital communication. Privacy, confidentiality. Are they comfortable sending private thoughts and messages through the internet? That lack of data for efficacy and safety. Liability issues. And research is needed to evaluate the risks and benefits. They're going to also find patient preference. You're going to find, especially younger patients, are going to be very, very receptive to these digital apps, whereas your older patients will be extremely cautious about them. When preparing for the clinical patient interview, choose an appropriate setting, somewhere quiet, somewhere comfortable, somewhere with seating. You're going to come in, we're going to introduce yourself, make the patient at ease, initiate the interview, set your goals, and set a comfortable pace. We don't want to just fly through all our objectives, but we also want to move quick enough that they're staying engaged as well. More tactics to avoid arguing, minimizing, or challenging the patient. Giving false reassurance. Especially on NCLEX, we never give false reassurance. We're never going to tell the patient in a difficult situation, hey, everything's going to be okay. You also want to avoid interpreting, speculating, or reading too much into a statement, probing into sensitive areas the patient doesn't want to discuss, trying to sell the patient on accepting treatment, joining in attacks patients launch on others, and participating in criticizing other staff members. That's a big one as well. These mental health patients can be extremely manipulative. You're such a great nurse, not like that other guy on day shift. You want to stay out of that at all costs. They will be very manipulative. They'll try to rope you into that. Remember, you are the nurse. You are that provider. You want to be open. You want to have a friendly, build a therapeutic rapport with them, but don't let them take you too far in either. Behaviors that support counseling and attending behaviors. First one's going to be kinesthetic communication. It's a type of nonverbal communication made by body movement, facial expressions, body posture, and gestures. And make sure we're maintaining eye contact again. But be aware that some people will avoid it. We don't want to force eye contact. You don't want to be too much with it. Just have a normal, direct eye contact. Let them know you're paying attention. And keep aware of proxemics as well, that personal space. Intimate distance in the United States is 0 to 18 inches. Personal distance is 18 inches to 4 feet. Social distance, 4 feet to 12 feet. And public distance, 12 feet or more. And that's really going to vary by the patient, both patient preference and culture. Clinical supervision and debriefing. This is communication and interviewing. These are acquired skills. They take practice. You're not just going to walk onto your clinical the first day and be perfect at it. But at the same time, the more you do it, the better you're going to get. Process recording. This is a written record of a segment of the nurse-patient session that reflects as closely as possible the verbal and nonverbal behaviors of the patient and nurse. Just like with every other documenting, we want to be objective, clear, descriptive. We want the next nurse coming on that reads this to know exactly what happened and how they should proceed. And finally, as a nurse assesses a new client, the nurse makes sure the door remains open. Which type of communication factor is this action? A, environmental, B, relationship, or C, personal? Again, A, environmental. You want to be very aware of your environment. Be very aware of where you are in the mental health facility. Always leave that door open. Avoid going into patients' rooms wherever possible. And again, this is things that you're going to find your own style as you work on the floor. You're going to find your own style as you get to the clinical site and get comfortable at the mental health facility. Maintain those boundaries. Be calm, and your entire goal is to build a rapport. Get those patients talking about their problems, telling you what's going on. And then from there, you can help formulate a plan that can help them. Otherwise, that's all we got for this. I'll see you in the next chapter.